Excellent. I think everyone's joined. I think maybe 2 people are just still joining the session. So I'll wait 1 second.
Welcome, everyone.
Hi, everyone. Welcome. Nice to have you here.
Excellent. Hi, everyone. Just a quick note from me, just some housekeeping to let you know that this session is being recorded today so that we can share it later with prospective students who weren't able to make it today. So if you wouldn't like to be featured in the video recording, please just keep your camera off, and if you prefer to ask questions, you can do that through the chat function. Equally, if you'd like to ask a question at the end without the recording being running, just let one of the hosts know, and they can stop the recording for you. Thanks. I pass over to Frederique. I think he's starting first.
Thank you. Thank you. Welcome, everyone. My name is Frederique Liégeois. I'm an associate professor in the Developmental Neurosciences department at the Great Ormond Street Institute of Child Health. And I'm also co-director for this program in Paediatric Neuropsychology. We also have Rhonda and Michelle, if you'd like to introduce yourselves.
Hi, everyone. So I'm Rhonda Booth. I'm the Senior Teaching Fellow on the programme, and I am involved in a lot of the organisation of the modules as well. So I'm co-lead on most of the modules. And we've also got Michelle here. Michelle.
So welcome, everybody. Lovely to meet you all. And yes, I am co-module lead on a few of the modules and have been with the programme for a long time. It's really lovely to meet you all.
So today we just have a few slides to introduce you to the program, but you're welcome to ask questions. At the end, we'll have a Q&A session. You can ask questions either by raising your hand and then unmuting yourself, or you can also use the chat, as in most Zoom meetings. Do you have any questions before we start?
Do you think you're in the right place?
Yes, this is Paediatric Neuropsychology at UCL. Fantastic. Okay, so maybe I'll get started then. So welcome to our program, which is an MSc, but also a postgraduate diploma, as you've probably read in the information. And Paediatric Neuropsychology means that we cover a lot of aspects of brain behavior relationships, looking at neuroanatomy, a lot of developmental disorders, and we're really looking at the brain basis of those conditions. And we also have the half of the program covering more the clinical and professional aspects of being a pediatric neuropsychologist. So you will learn a lot about the techniques to look at the brain function and brain structure. You will learn about profiles in developmental conditions and acquired childhood conditions. And you will also learn about the role of the pediatric neuropsychologist in different settings. So as you are probably aware, we have 2 pathways for this program. One is the clinical pathway, which is open to people already clinically qualified, and you can read the specifications here. And we also have an applied pathway, which is really open to people who have an undergraduate degree in psychology and who are not yet qualified or maybe qualified outside of the UK. And the 2 pathways are taught together. So the content of the modules are identical and they're taught in the same classroom. So you will, whatever pathway you choose, you will also be taught and have peers who have maybe less experience than you or more experience than you, or we also have a wide variety of backgrounds, which is always making the course extremely interesting and the discussions quite lively. So you also may be aware that we have 2 types of. Sorry, Rhonda, did you say something? We have a full-time course, which is over 1 year, and that's either applied or clinical. Or you can also do the course over 2 years if you're choosing the clinical pathway, which we call part-time, but as you will see, it's a bit misleading to call it part-time. Effectively, you are doing half the course in the first academic year and the other half of the course in the second academic year. And in terms of the module structure, we have 8 compulsory modules. Nothing is optional. And those modules are taught over 1 week. So you will be face-to-face in a UCL building, Monday to Friday, with a week-long module, lots of lectures and activities happening. If you're choosing the Masters, the MSc, on top of those 8 taught modules, you will also carry out a research project in the field of pediatric neuropsychology. So that could be with clinicians or with researchers looking at imaging or clinical populations. So we have a wide range of research project topics. And this module really runs from January to August, more or less. So you'll have to write a research dissertation after that. So we have the Masters if you have the 8 modules plus the project, and the postgraduate diploma if you're only taking the 8 assignments for the 8 compulsory modules. So these are some of the module topics that will be covered. So we have neuroanatomy, developmental cognitive neuroscience. We cover typical development in terms of sensory, motor, and cognitive systems. Importantly, also how we assess cognitive functions, and also how we diagnose some neuropsychological disorders. And you also have a module looking at clinical formulation and interventions. So you're taught by cognitive neuroscientists, neuroanatomists, but also clinicians and people who work in different settings. So what we try to do really is trying to provide some training in this course to make sure that when you leave the course, you have, you know about methods and statistics that are relevant to pediatric neuropsychology. So this is through the completion of the research project and academic teaching. And also for the clinical pathway, we are accredited, as you know, by the British Psychological Society, the BPS, so that the content provides what is called the knowledge element if you wanted to qualify as a clinical pediatric neuropsychologist at some point in your career. So these are the core modules that we have. I can let you read them, but we look at the introduction to developmental cognitive neuroscience, introduction to methods such as imaging or electrophysiology, and as well as neuroanatomy. We do expect you very early on to try to get familiar with different parts of the brain, where they are and what they do. Then we have a second module that is a bit more clinical, looking at professional issues. Third module is looking at typical development. That's the foundation, so that you're prepared when you look at disorders, how those children with specific conditions deviate from the typical development. So we look at sensory, motor, and cognitive functions, looking at memory, attention, literacy, a wide range of cognitive functions. Then module 4 looks at examples of disorders. Module 5 is looking at infant and neurodevelopmental assessments. So this is one module led by Michelle, who's an expert in early years development. Then module 6 is again another more clinical module looking at assessment of disorders. Then module 7 is building on what you've learned during module 1 to 6, looking at more advanced developmental cognitive neuroscience methods. So we look at really cutting edge research, advanced methods to look at brain function and brain structure in detail with the latest MRI techniques, for instance. And then finally, the last module that is taught is about clinical formulations and interventions. Module 9 is really supervised, like I said, between January and August, and you will have to write an article that is an original article based on your project, as well as a systematic review, which is going to be based on your reading, and you will get some support for that.
Great. Do you want me just to outline the exams and the coursework?
Oh, yes, please. I'll mute myself. Thank you, Rhonda.
Yeah, it might just be better just to go back to that, to the previous slide. It might be just easier just to outline it first. If that's okay, great. So wonderful overview. Thank you, Frederique. One thing to say, I suppose, is that all these modules build on each other. So you have to do them sequentially. So if you were doing it part-time, you would be completing 1 to 4 and then coming back to 5 to 8. And I just we're sort of going to say this again and again, because it's just, it is a kind of, once you're here and you realize that you're doing 2 lots of, or essentially full-time courses. So also just, I put in red just the months that the modules run, that generally in the first or second week of each month. So it is, from October right through to June, you are almost, you've got weekly teaching blocks. And also, if you're thinking about, well, what's the workload going to be like? So half of these modules are assessed by a written assignment. So that would be a 3,000-word essay for modules 2 and 5. And for modules 4 and 8, it's 1,500-word commentary. So making a comment on a paper or a couple of papers. So that's half the coursework. As you can guess, the next half of the modules, it's actually assessed by an exam, a closed, well, actually now it's an open book exam, online exam. So for modules 1, 3, and 7, the format is 90 minutes, a timed exam, a lot of multiple choice, short answer. They might be assessing your knowledge and also your understanding by writing a couple of sentences as well. Module 6 is also a timed exam for 90 minutes, but you are expected to produce and write responses to 3 questions. And again, it's your unseen exam, so you won't see those questions before the exam as well. Right, I think we can come back to any questions you have. So we also wanted to give you a bit of an overview of what the snapshot of a year might look like. Just to sort of try and look, give you a bit of more of a global view of when the assessments are, when the modules are, and looking here, we always run workshops that I will be involved in, just to help you think about how to write an essay or a commentary, and giving you, say, mock exams, which are sort of timed exams, just to give you a feel for what it's like to do an online exam as well, for, in case this is a new thing for you. So, so this is what it looks like if you say you're a full-time student and wanting to do the master's project. It's giving you an idea of when all the coursework is, and then when you're expected to hand in your project and also do an oral exam at the end. So the next slide would just show you what it would look like if you're a part-time student. So maybe you're a clinician and you just want to do the postgraduate diploma. It looks quite nice, doesn't it? But it all is scrunched up. So you are doing those first 4 modules, and you are submitting coursework and the timed exams exactly the same time as everyone else. So you would have, so 2 pieces of written work and 2 pieces of 2 exams. And then when you return, basically a year later, it will be completing modules 5 to 8 with, again, 2 exams and 2 pieces of written coursework. Great. I think we thought that was some of the important things to know. So are you happy to stop sharing and we can take questions?
Absolutely.
I hope that's given you a bit of a flavour of the course and what to expect. But we would like to just sort of turn this over to you and be directed by what you'd like to know. So feel free to unmute.
I had a few questions, but do let me know if it's better to do one and open it up to others.
That's great.
Yeah. One was about the content itself, and the others are more practical. So maybe the content one first, about the interventions. I'm just wondering more generally about the discipline, if clinical neuropsychologists often deliver the interventions, or it's more advice consultation type for other professionals to support with this.
Okay, so you're talking more about sort of whether taking into account the multidisciplinary aspects of treating a case, and what we may be teaching, and what sort of, is that just trying to...
Yeah, I wondered if that module is like the vast majority is interventions that we would deliver as clinicians, or
can you specify the module that you're talking about, just to be clear?
The final module.
Yeah,
the final
that's
module. Okay.
yeah.
Yeah, I think that's an interesting point, because we do, it is sort of quite broad, because we you know, we're working with speech and language therapists. We might be, you know, working in a head injury team where you might be sort of working alongside occupational therapists. So I think it's giving you more the knowledge base of the interventions, and it could be things that you design and put into place, but together, you know, it may sort of be working with other clinicians together. So that I suppose something we haven't sort of said is that you know, this is an academic course, it's the knowledge base, so it's, you know, lecturers will bring in case studies, but we won't, you know, necessarily, there's no actual training. What I'm trying to say is, you know, there's no placements in this course, so it's there's no supervised clinical placements. So I hope I'm answering your question. I suppose it's you know, working in lots of ways to understand the child and the neurodevelopment of the child, and from that developing intervention programs. Yeah,
That's helpful. Yeah, knowing the evidence base more than being prescriptive about who has to deliver it. Okay, yes. Thank you so much.
Got a question in the chat, I think. Oh, lots of questions. So the first one is about, is it possible to do the postgraduate diploma and then take the research module and upgrade to a master's at a later date? No. So I think you go in and you do one or the other. A lot of people do take on the master's and then actually realize the commitment involved, and they may go down and then enroll in the postgraduate diploma. That does happen, and it's understandable. Once you sort of realize, you know, the time commitments, or you may have change in your situation, but it's not, we can't offer the master's project size, so that's module 9 in isolation, so that has to be done together.
Maybe I could say that if you're doing the master's part-time, the clinical master's part-time, then you'll be working on just a proposal of the project in the first year, and then you will do the actual project research the second year.
Great. So we'll keep on the questions. So there was a question about what the ratio of clinical neuropsychologists providing the teaching. Ooh, I've probably got that statistic somewhere I could look up. I don't know, I would say we've got maybe a third, because we've got academics and neurologists, but clinical neuropsychologists.
And it probably depends on the module, right, Rhonda?
Does,
I mean,
yes.
some modules are a bit more led by clinical neuropsychologists, whereas something like advanced developmental cognitive neuroscience, that's going to be a bit more academic, right? Or neuroanatomy. We're going to hear about neuroanatomists from your neuroanatomists. So I think it depends on the module a little bit. Sorry to jump in, Rhonda, but would you agree?
Yes, I think there'd be more contribution from clinicians in the modules. We call them all clinical modules in a way. But yeah, we don't have an exact number about the ratio.
Mm-hmm.
And also think that we are, our speakers would be clinical pediatric neuropsychologists, and there aren't that many in the UK. So we try to invite all the specialists in the field in this course. And we've had lots of great speakers who are really specialized, but they just aren't that many of them either. So we also have a lot of cognitive neuroscientists or people who are at the interface between research and clinical research.
Yes, yes. And like you say, we work hard and we do get the specialists in the field. And so ever so often, maybe sort of once, maybe twice in a module, we may have someone zooming in from overseas as well. Let me just go back. So is there anywhere to see the more detailed breakdown of module content? Would that be the module diet, the that's online? Just trying to think of the name of it.
Yes, the module catalogue.
Yes.
Right. Yes, so you'll be able to see the module breakdowns through the prospectus page, which has a link from each module title to the module catalogue. So I'll drop the link to the prospectus page in the chat.
Lovely. Thank you, Alison. Great. Right. The course page suggests 140 hours of study per month, but as a clinician and a parent, this sounds a lot. Yes. How do people manage the course alongside contracted NHS work? And is there any plan to develop a truly part-time option? I think a truly part-time option would be difficult in this current structure of our modules because they do build on each other. So we start off with the foundation of neuroanatomy, and then we build on, understanding the basics in sensory systems, and what you take over your learning, and then actually even when you do your assignments, it's built on previous knowledge and theories that have been introduced. So I think trying to space that out more than what we do would mean you would take a module, maybe 2 modules a year, and then coming back and do 2 modules, so on and so forth. So that would be an operating model that if so you would space it out over 4 years. So they do 1 and 2, 3 and 4, and so on. We haven't proposed that, but if that's an option, I suppose it still means you still have to take that week and have time within that month or in the following month to still do the coursework. So so not at the moment being able to space it out.
I can reassure you, we've had some successful students with busy family life, and you do need to take time off work for module weeks, but also advice. But it can be possible, but if it's not the right time for you, then have a think. You do need to be able to have follow those 4 modules and take the assignments in year 1.
Yeah. Right. So considering the workload on the course, how much content is delivered on a weekly basis? Are we to expect lectures, seminars, workshops to run Monday to Friday, or will they be occurring on specific days? So the majority of it will be specified within that week, Monday to Friday. But what I found is that sometimes when it's almost able to digest the information, then focus on the coursework. So we may run a workshop on the assignment sort of a week or 2 following the module. And we've got material and course material that we realize can be worked with asynchronously. So we put up pre-recordings and material for you to access before, because I think it's it's a lot to ask you to cover and digest all the information within a week. So it's you may sort of dip in and out of the pre-readings and things, but the lectures and seminars will mainly run the Monday to Friday.
And also maybe just to say that usually that lectures are normally recorded, so they're available to look at later if you need to digest information at a later time. We do expect attendance, obviously, so that's not an option that you would just look at the video later, but that's maybe just something if you feel more time to digest the information. It's just to provide you with an opportunity to relook at something and see a lecture. But it's not, just to emphasize, that's not instead of attendance. You're expected to attend face-to-face lectures.
Also, maybe it might be worth saying that if you are a clinician, and as soon as you are enrolled, you will get the yearly timetable, so you will know in advance which weeks are expected you're expected to be at UCL for module weeks, when the assignments are. So all this will be available as soon as you've enrolled, including reading material and so on. So you do have this opportunity to plan your year ahead if that's helpful for your circumstances, whatever these are. Maybe I can answer the quick question about the BPS accreditation of the applied route. At the moment, it is not, is the short answer.
There's another question about having to have a placement following the completion of the knowledge base, or after you, or are you able to then apply for jobs as a paediatric neuropsychologist? Very clinical question. So it's not, I suppose it's not, I think that's to do with your own career path and what you want to do. So there's, and it would be a conversation to have with BPS as well about that. That makes sense.
Yes, our course covers only the knowledge dimension. So everything else you'll have to organize outside of our course.
Yeah. So Leanne, I know you've got your hand up as well. I just don't want to lose track of the online questions. One is having a clinical experience with children essential to getting onto the course despite having extensive experience in adult mental health? No, it's not essential. You would just need an interest and an enthusiasm to want to work with children. So it's not essential.
I think I can say the fees are different for PGDIP and MSc. So look at the UCL website, because of course there's an extra module with the MSc. So yes, that'll be cheaper to do the PGDIP. And this year we are teaching face-to-face following UCL recommendations. So, and we're teaching face-to-face this year as well, actually, but next academic year also we will be in a building at UCL and have in a class somewhere Monday to Friday, which is also really nice to have discussions and interactive sessions.
Question about applying for the program if you've studied linguistics. So no, the requirement is a bachelor's in psychology. Student fees about the question about paying upfront or paying installments.
So fees are not dealt with at the program level, they're dealt with at the general central UCL. So look at the fees website and to see if there can be, again, depending on your circumstances, scholarships or help. So unfortunately, we're not in a position to answer that. I'm sorry.
Leanne, you've got your hand up for it. It must be getting tired by now, so please ask away.
No, it's all good. First off, I do apologize. I think my mic by accident turned on at some point and I may have disturbed it. I do apologize about that. I'm just walking from one lecture to the other. So yeah, apologies. My question is just about the research, the research project that runs from January onwards. Are the topics predetermined, or is this something you kind of develop with academics within the course? And if you're kind of developing the idea or the research question or whatever it is that you're doing, is this something that we start in January, or do we start it a bit beforehand? But that's about the only
I can answer this one because I lead that module. Thank you, very good questions. And I think I can say we have a range of options. So when you start the year, I will have a portfolio of potential projects with supervisors to choose from in the field of pediatric neuropsychology. So you could have some projects that you're particularly interested in that you join, but also you can have a conversation with myself as research tutor if you're particularly interested in one field, seeing whether there's another supervisor at UCL that could supervise your project. And there's also a range in terms of the students' input. Some students work on existing projects with PhD students, for instance, so there wouldn't be so much scope for, in a way, a change of research question, but some students would be paired with a supervisor who have some data, in which case the students might be encouraged to design their research questions and their analysis pathway. So it's very variable, and and this is something we think about during October to November, and all students have to submit a research proposal early in January. So you think about it, meet supervisors during term 1, and then hopefully you've made your decision by Christmas, and then you would have written a proposal so that the actual research project can start from January up to the end of August.
Brilliant. Thank you so much. That clarifies a lot of things. And again, I do apologize for the disruption, but thanks.
No worries.
I hope I haven't missed any questions in the chat. Sort of scrolling along.
I think we sometimes get a lot of questions about workload, and it's important to highlight if it's a full-time course, even if you're doing it part-time, it'll be full-time for half a year, more or less twice. We have to emphasize that on top of those module weeks, there is a lot of study time, revision time, and assignment time. So it's a busy course that is not easy in a way, so make sure you've got time for this. So I think if you're working, you might need to only work a few days a week, but we encourage students to really have a lot of free time for studying, because we cover a lot of content, as you can see, and you've seen from the timetable as well that from October onwards you basically have a module, an assignment, a module, a revision, an assignment, a module, an assignment, so things happen one after the other. On the other hand, we've had a lot of very successful students who have managed to get distinctions even though they were working as clinicians as well, or had busy personal lives. So it all depends on what you think you can really cope with, and if you're really passionate about pediatric neuropsychology, I think we can say that in the past students have said that they thoroughly enjoy the course, and it is quite unique in the country. So it could be a good opportunity for you to realize whether this is a career for you, and whether you would like to go into research or maybe a clinical career after your master's or PG dip. Are there any other questions you can see or that I haven't missed?
This is probably another clinical question. Some of the other masters in applied neuropsychology courses in the country allow for fast tracking of the QICN after attaining a clinical doctorate due to providing the knowledge aspect. Is this something that the course would count towards as well? It does count towards the knowledge.
Yes, but I don't know about fast tracking.
No,
I think again this could be very specific to the doctorate you want to go into after you've done the PG dip or master's. So I don't think we have any specific fast track route after our course, to my knowledge. Maybe I can say that the other co-director on this course, Sarah Cheval-Jessup, is a qualified pediatric neuropsychologist. So she is usually the personal tutor for all the clinical students, and she'll be able to answer the questions related to BPS and how to qualify for pediatric neuropsychologists. And she will be available on the 22nd when we have a sort of conference day where we showcase some of the research projects that our students have carried out. So if you want to come to that session, there will also be a Q&A session where Sarah will be able to answer some of your questions.
Yeah, that's great. And also just to mention that people on the applied route, we've got a great career lead in our program, Jane Gilmore, who is a clinical psychologist, and she runs really good sessions if you're in the applied route and you're looking to go into clinical psychology. She does great career sessions and provides advice on how to apply and the route and everything. So there's a lot of support in that as well if you're in that career pathway.
Michelle, do you want to just put in the chat the thing on the 22nd of February as well? I went to do it.
Or is it a slide that you had? I can't remember. So I can answer maybe the last question about what students do after that. So indeed, some of our students after the masters end up in PhD programs, either in clinical psychology or psychology or cognitive neuroscience, or a wide range of programs. Some of them go on to have positions as assistant psychologists or research assistants. Some work in the charity sector in specialized settings for children with developmental conditions. So we've had, I think, over the years, a lot of successful students who have followed their passion in different areas, but the masters does prepare you for PhD and doctorate work, especially if you have a good mark and you wish to enter those more competitive courses. We have students who've had studentships as well, PhD studentships. So it does prepare you for an academic career in this field, if that's what you'd like to do.
Right, and there was also just another question again about the QICN. Again, if you have a doctorate and then the diploma, would you then need to seek out additional experience? So that's your doing the case study. So this is a good question to talk to Sarah about.
I think it's difficult to answer those questions that are really depending on your own experience. So as all we can say is that our course covers the knowledge dimension. So everything else you have to either have acquired before or acquire after that, basically, depending on what you're doing next in terms of QICN.
And I guess just maybe to emphasize that that's with QICN, but in terms of the MSc, we provide opportunities for people to engage in clinical research projects. That is part of the program, but that's a bit different from the QICN aspect of it, because I know there might be a mix of people on the course.
It's true. Some of our projects are actually with clinical psychologists, so looking at data from children with a range of conditions and looking at brain behavior relationships or cognitive profiles. So you might have this sort of link with some clinical settings on the research side of the project, which is also interesting. A lot of our academic at the Greater Ormond Street Institute of Child Health work with patients who are treated at Great Ormond Street as well. So our academic department is linked to the neuropsychology department at Great Ormond Street Hospital as well. So there is overlap on the research side as well. So your project could be at the interface between really clinical research and cognitive neuroscience research.
Right, I've just put in this chat now the future leading us to the future showcase of postgraduate research. So that is happening on 22nd of February from 1 o'clock till 5. And some of our former students are presenting and talking about their projects. And it should be a really, really interesting afternoon. I think it's free, but you sign up through Eventbrite. So you can have a check on that.
And that's an online event as well.
It's online, and it's also a chance. Sarah, who we mentioned, who is our clinical pediatric neuropsychologist, who's co-program director, she's going to be there, and there will be part of that. If you look at the sessions, she's going to be there for a Q&A session to emphasize. So if you want to join along and just ask additional questions, she will be there.
Brilliant. Our students really enjoy the program. We get a lot of very positive feedback. I think we keep in contact with our students and see where they go next. I think a lot of the clinicians that I talk to, even sort of years later, they realize that, it was a lot of information to digest at the time, but they actually see in their work how they're implementing, how they're thinking about different ways and how they're dealing with a child. And so it may not have an immediate sort of impact on how you sort of work clinically, or but it, you know, can sort of filter down as well. But we've also had a lot of our applied students doing the masters, going on and doing research assistant posts or psychologist assistant posts as well. And they often just sort of make contacts with other people in the course, and actually make you know, good links there, and get offered sort of placements and things like that with the other clinicians in the room.
Okay, well, if there aren't any further questions, thank you so much for coming. You're welcome to ask questions, you know, that maybe might pop into your head later via email. We're always happy to answer those. There's quite a lot of information on the internet and the course description as well. If you want to dive more into the content of each of those modules, they are on the module catalogue, so maybe familiarize yourself with this to make sure that this is something you're interested in. And yes, thank you very much. We hope to see some of you maybe on the 22nd, and if not, we hope you have a lovely afternoon.
Thank you.
Thank you everyone for coming.
Bye.
Bye.
Thanks, everyone. It's nice meeting you all.